Hey guys, so today I wanted to talk about the nursing process, and the nursing process is a systematic approach to planning and managing patient care. And I'll give you the acronym to start, and it is ADPIE. So when you think about the nursing process, remember ADPIE, ADPIE. So the A would be assessment, and that's where we're going to collect and gather our data, right? The D would be a nursing diagnosis, which is different than a medical diagnosis, which we can talk about as well. The P would be the planning. So what kind of interventions are we going to put into place to manage this diagnosis, right? So then the I would actually be implementing those interventions that we planned for. The E is probably the most important part to me because that's where we evaluate, and when things aren't working, we're going to start over and we're going to redo the plan. So, and come up with new interventions that seem to work better for the client. So I just want to get into the difference between a medical and a nursing diagnosis. Like, as a doctor, they're there treating illnesses and disease, where we are treating the patient and we have a more holistic approach to care. So when a doctor sees a patient, they're going to look at them as a fractured distal radial bone, right? Now, when a nurse sees a patient, we're going to look at them as having acute pain. And so our nursing diagnosis would be acute pain, because yes, they have a fracture and that's what's causing the acute pain, but we are focusing on the acute pain because that's how we can help our patient. So we have our diagnosis now, that would be acute pain, and now we're going to plan interventions for that acute pain. So interventions for acute pain could be administering NSAIDs as prescribed. It could be administering analgesics before going to physical therapy. It could be elevating the arm above heart level to reduce swelling. It could be relaxation techniques. It could be physical therapy. It could be utilizing heat and ice as appropriate. And then when we go to implement those interventions, this is really where implementing and evaluation kind of go hand in hand. As we implement, we're going to constantly go back and see if they're working. So if I administer a pain med, at 1 o'clock, I'm not going to just go all day and not check in on my patient. Within an hour, I'm going to go see how they're feeling. When I notice that it's not working, that's when I'm going to reconsider our pain management options. And that might include talking to the physician, saying, hey, Miss Johnson's got a pain level of 8. She's already been administered an NSAID. This is what she was given at what time. She's still sitting at an 8. What else can we do for pain management for Mrs. Johnson? So those are things that we're going to constantly change. So it's important to know that in order to provide optimal level of care to your patient, and patient-centered care, which is the most important part, is that we need to constantly change the plan to fit the patient's current needs. So hopefully that made sense to you, and if you have any additional questions, please feel free to drop a comment down below and we can get it sorted out. But that's my initial video on nursing intervention and the nursing process as a whole. All right, peace out, guys.